I'm a radiological technologist here at Jamestown Hospital.
And I'm Tania. I'm a radiologic technologist at Jamestown Hospital also.
And we're going to talk a little bit about cardiac CTA. As far as the training we went to Milwaukee, Wisconsin to the GE Center itself for a week. And there we learned how to run the computers as far as learning what to do with the data that the CAT scan will provide for us.
We also learned the anatomy of the coronary arteries, the arteries that basically go around the outside of the heart, that basically feed the heart muscle, which also makes the heart beat. So with the new 64-slice CT scanner, that's how we are able to acquire the images for the CT, for the cardiac CT, so we can get the images of the heart for the coronary arteries.
Okay.
So what does that provide for the doctor to look at? What does that help tell him? The new images.
Yeah, the new images, what it provides is we're able to check for what's called stenosis, and that's basically a narrowing of the arteries. What that will mean is there's not as much blood getting through your arteries that should be. And that can cause things like chest pain, shortness of breath, those kind of things. Those are pretty much the common symptoms that'll give a person. And there's other symptoms too. That's something your doctor would have to talk to you about, but those are the basic things. We can look for things like soft plaque and hard plaque. Those are two different variations of plaque that we can also distinguish with this test.
So the benefit of having this test is what over having invasive surgery, for example?
Yes, it's not invasive. You come in, you get an IV started. The day before, the doctor will give you a medication. It's called the beta blocker, and that's going to lower your heart rate. That's a very important step of this test, but basically it's just an IV. You come in, see some smiling faces.
And it's a lot easier than driving all the way to Fargo or Bismarck, which is 100 miles away, to get this test, which is very simple. The pictures only take, 30 seconds at the very most. So it's a wasted trip to drive 100 miles for this simple of a test.
And then the benefit of having this over perhaps the more invasive is what? I mean, can this prevent having to do that?
This can, yes.
Yep. This is kind of, I don't want to say the same thing, but what I would call a first step. And a screening into if you have things, like I said, chest pain, shortness of breath. It's kind of your first step, and then if they find something, they may do something such as an angiogram just to verify, whereas they might have to put stents in or open heart surgery.
In a nutshell, what is the benefit to the patient of the new technology, the new CT scanner?
The biggest benefit is it's not invasive. That's hands down. Like I said, you come in, you have an IV start, where things, of course, with open heart surgery, you're going to have many weeks to months of recovery time. Things like an angiogram, they go in through your leg. There can be complications from that. This is pretty easy, pretty minimal. You come in, you have an IV, and that's about it.
There's not much recovery, maybe a half-hour, little bit of recovery just to get your blood pressure and your heart rate back up just from the medications we give you ahead of time. But other than that, that's the only recovery you have from this test.
You come in and you leave that day, so you come in that day and leave that day.
Great. Thank you very much, ladies.